Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.
Kim Butler of Balsam Lake is the Democratic candidate in the 28th Assembly District. Kim, welcome to WisconsinEye.
Thanks, Steve. It's good to be here.
What do you consider the top issue in your campaign?
Healthcare. I'm a 12-year cancer survivor, and my husband and I own a small business. I'm also the mom of 2 teens. And so we've seen Wisconsin healthcare from all sides. We had private insurance before the ACA, then the ACA came along, and that improved our access to insurance, but the cost hasn't gone down. When I'm knocking on doors, people tell me that it's too expensive, they can't get it. We have a huge mental health problem and a huge addiction problem, and there's not the services that we need in our county and our district to handle those.
What's the best way to protect and expand healthcare in rural Wisconsin?
Well, I'd certainly like to take the Medicaid federal money that hasn't been taken, that's cost us $1.7 billion. I'd like to open up Badger Care as an option for everybody to buy into. I've heard that that can save us up to 25% in premium costs. I'd like to see if there's a way to get rid of the zip code prejudice. The northern part of Wisconsin, my county in particular, pays some of the highest rates in all of Wisconsin. If I moved to Madison, I could pay almost $400 a month less, according to calculations I made a few years ago when I put in a different zip code when I was applying for my insurance. So we depend a lot on the subsidies because we are a high poverty area. And if those get taken away, that's going to be a real problem for people. The other thing I'd like to do is see if we can open up our own exchanges for small businesses so that they can bind together and get cost reductions that way.
Does the state have a duty to recruit and retain doctors, nurses, and other medical professionals?
I think so. The wait that we have to get for mental health services can be 8-9 months to get in to see a therapist at my local hospital. I know that therapists and psychologists and psychiatrists are retiring at a faster rate than they're graduating from med school, and we need incentives to bring those doctors who are in scarce supply anyway to our particular community. It might not be that we can pay the highest wages, but perhaps other incentives like repayments on student loans, which may already be in existence, housing help, which is another problem in our area. We don't have a lot of affordable housing or housing stock that maybe a young doctor would want when they move to our area. So there's lots of factors involved in that.
State government and Delta Dental have a program that subsidize dental clinics in medically underserved areas. Should that remain a priority in the next Medicaid budget and the next state budget?
Totally. It's, I'm frightened about the lack of medical care for people who have income problems. There's a free clinic once a month, and they have waiting lists. I read that article in the Washington Post about people who line up before dawn to get into a coliseum to get free dental care. Mm-hmm. I heard a story recently about a woman who's on Medicaid whose teeth were literally falling out of her mouth, but she had to wait months to get an appointment in Eau Claire, which is a 2-hour drive. She needed a hotel room. I mean, just the list of problems that this woman faced to get basic dental care was absurd in this country, in this state.
Local governments have been dealing with levy limits to control property taxes for 13, 15 years. Some local government leaders say this hurts their ability to provide local services. Repeal levy limits, ease them back, keep them in place?
Well, I've talked to a lot of those local government leaders, and that is a constant complaint, is the levy limits. Our towns and villages and cities are expected to do a lot more with the same amount of money. And sometimes I think that the way the levy limits are structured actually encourages more development in areas that might not be environmentally sound. So yeah, I would loosen the levy caps to start with and see if that will help.
State government authorized $100 million for school safety grants. Is that enough, or do we need to change gun laws, Kim?
I think we need to change gun laws. I live in a community where hunting and sportsmanship and guns are very important. A lot of families wouldn't have meat on the table if they didn't hunt. So I am very respectful of Second Amendment rights, and I want to make sure that those are protected. But these are also parents, and I think that I know they agree with me, that they want their kids to be safe in schools. So I think that we need to work on common sense safety laws that won't infringe too much on somebody's right to own a gun.
Do we start with closing what's been called the loophole for sales?
The gun show loophole?
The gun show loophole?
Yeah, I'd like to see that done. I'm interested in learning more about expanding background checks and possibly a waiting period, and also giving police more say in whether a dangerous person or a mentally unstable person or a known domestic abuser has access to guns. A lot of these proposals are put together by the Wisconsin Sheriff's Association, and as law enforcement officials, I think that they perhaps have the expertise to know what's going to keep our communities safe.
The impasse in the Capitol over how to pay for highways, bridges, and maintenance. How would you solve that impasse?
I wish I knew how to solve it. I will say that in our district, roads are not the huge problem that they are in the rest of the state. But our counties, our towns are struggling to pay for the maintenance that they need to do. We've had roads go back to gravel in our district. They've since come back, but they're getting the same amount of money that they've been getting with no increases, and expected to do a similar amount of maintenance as costs of asphalt, of oil, of labor, of machinery all go up. So I would like to see obviously more money sent to rural areas. How to solve what's going on in southeastern Wisconsin with the huge road projects, that I can't answer yet, but I look forward to learning more about it.
The debate over school funding. The current state budget had a significant increase in state aid for public schools. Is it enough? Do we need another significant increase in the next state budget? And if we do, how would you pay for it?
Well, my understanding is that compared to, say, 2008, 2010 levels, this budget increase is really not anymore when you factor in inflation. And I think that we need a large increase. One of the reasons I'm running is that I have one high schooler and one recently graduated teenager, so I've seen the budget cuts firsthand, forcing early retirement of experienced, wonderful teachers, cutting programs in their district, and the district struggling to retain teachers, to attract teachers. So yeah, I definitely think that we need to invest in education. I would start by making sure that we had a fair tax formula.
And you'd make what changes in the tax structure?
I think that perhaps upper income people aren't paying their fair share. I don't want to increase the taxes of working people, of middle class people, but I think those at the top have benefited a lot in recent years from manufacturing and ag tax credits. I keep hearing about the same 11 to 15 people that are reaping millions of dollars of benefits. To me, that's not fair.
The voucher, the choice program that helps private schools, that helps students attend private schools. It's grown from Milwaukee to Racine to statewide. What's your position on, should it stay around and should it expand even further?
I'm not a fan. I think that public tax dollars should go to public schools. 70% of the children who attend private schools on vouchers or religious schools on vouchers were already enrolled in these schools beforehand. And so we're really subsidizing, in large part, wealthy people to send their kids to private school. I don't think that's right. It's straining our public schools. These voucher schools don't have to educate everyone. They don't have to take special needs children, and they're not accountable to the taxpayer. It's not transparent what we're spending on these schools. It's not, they're not held to the same accountability standards on test scores and things like that. So I would like to phase out most of the voucher program.
The big decision in the next budget on whether to build a new prison. We have 2 prisons that are built in the 1800s. Do you have a position on whether we need a new state prison?
Well, I find it very frustrating that in Wisconsin we now spend more on prisons than we do on education. I'd like to flip that for sure. I think that the first thing we can do is start decriminalizing marijuana and perhaps get rid of some of those low-level petty drug crime people that are in prison. I'd like prisons to be for people who have actually committed violent, awful crimes. I really don't want to spend money building a new prison, but I do want to make sure that our prison workers are adequately compensated and that our prisons are safe. I also want to focus on rehabilitation. Where I went to college, they do a program where they work with a correctional facility and they educate prisoners. I've seen those guys come out of that program and turn into counselors and social workers who are then on the street with their college degrees working with children to steer them away and to steer them down the right path. That's the kind of rehabilitation I'd like to see happening more in our prison system.
Some Democratic candidates for governor suggested that the state prison population could be cut by a half over a few years. Do you share that belief?
I would have to look at the figures. That seems high, but I know that there is a huge proportion of African American men who are there on lower level drug crimes, and I don't think that that's right. So I would want to see before I committed to saying half, but I certainly think that within that half, there's a lot of people that could be released.
What are your thoughts on the next steps that should be taken to help fix northern Wisconsin's methamphetamine problem?
Well, I think it's a two-pronged approach. One of the reasons I'm running is I haven't seen a push to get family supporting jobs in our area. So people are struggling. They're working full-time, but they're not getting ahead. They can't provide basics for their kids. Our teenagers graduate and they don't see any careers for them in that area. And if they want to stay in that area because they're connected to their families, there's not a lot for them to do. So there's a level of hopelessness out there that I think leads to perhaps experimenting with drugs. The other thing that we've talked about is mental health care. We need school psychologists and we don't have them. We don't even have librarians in our schools now. We need psychologists, we need social workers to identify those kids and stop this cyclical problem that we have of kids growing up in families with addicted parents who then become themselves addicted parents. And I think that we need some intervention to stop that. And we need to work on the poverty level and get that up, get people paying paid family supporting wages.
Does that mean you support an increase in the minimum wage? If so, how high?
I do. I was initially leery of the $15 minimum wage proposal because I mistakenly assumed that, boom, it's going to happen all at once. And I've seen the bill that I think was introduced in 2015 that brings it in gradually over a span of 5 years. The first increase moving to $8.25. I would want to talk to more small business owners in my community because I do think that what works in Milwaukee and Madison might not necessarily work in rural Wisconsin, and I want to make sure that if we increase the wages, we're not in any way harming our local businesses and that the economy will grow enough so that they can afford it by the time the $15 wage phases in.
UW system budget, should we continue the tuition freeze on resident undergrads?
I don't like the tuition freeze because I think it just makes classes more crowded, and I think that it sometimes can make it harder to graduate. So you might be in the system longer, and I don't think that that's the way that we need to work on this. The UW system used to be the gem of our state, and I would like to work on bringing funding back to those levels so that we're not pushing out high-quality professors, so that we're getting that research dollar amount that we need, so that we're seen as a leader in research and in education.
Colorado has seen a boost in tax revenues after they legalized marijuana. If Wisconsin legalized marijuana and it became a source of revenue, how should those revenues be used?
Well, I'd want to study what other states do and use them to create model legislation here in Wisconsin to figure out how much to tax, who perhaps to allow to grow it, how to sell it, regulations and the like. But I would like to see the money spent on both education and on mental health care and addiction treatments, and specifically those two areas.
And final question, you're running in an open seat. Differences between you and your Republican opponent?
Well, my opponent is a big supporter of Representative Jarko, the current occupant of this seat, and she has all but said that she's going to largely carry on his policies. She's a retired pediatric nurse who practiced in Minnesota, and while I'm sure that that allows her, excellent knowledge of care of people, I don't know if that gives her expertise on policy and the problems of health care. I've been in the trenches with insurance. I know what it costs to get a digital mammogram, to get my kids broken metatarsal bone or their vaccines. We've been paying these bills. At one point, we had 3 policies for my family of 4. So I've been down in the trenches dealing with insurance, and it's a deeply personal issue for me. And I love policy, and the best thing about running for office is the amount that I'm learning about different things. There's no black or white answer, so I don't have some rigid guidelines that are going to keep me going in one direction. I want to represent everybody in our district, not just the people who support or voted for me.
Kim Butler of Balsam Lake is the Democratic candidate in the 28th Assembly District. The election is November 6th. Kim, thanks for talking to WisconsinEye.
Steve, thanks so much.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.